Well, good day, Alan. Thanks for joining me today. For those of us that don't know much about medical bridges, could you tell us a little bit more about it?
Of course. No, thank you so much for having me on your podcast. It really is my pleasure. So Medical Bridges is committed to making a difference in global healthcare. We really focus on repurposing surplus medical supplies and equipment to provide aid to underserved communities around the world. This also includes rural areas of the U.S. as well. So whether in conflict zones or disaster-afflicted areas, our team is committed to addressing the specific healthcare needs of the recipients.
For those of us who might not know, what are we talking about in regard to surplus medical equipment in the United States? What's the volume?
So it is kind of a misunderstood concept. When we say surplus medical supplies, a lot of people would think, oh, someone just accidentally over-ordered something when it came to an operational oversight. But really what it comes down to is just the ever-evolving landscape of the medical field. When it comes to technological advancements and making sure that items are sterile, we really pretty much repurpose a lot of these items so that they can be used. Now, when it comes to our sustainability, many hospitals and clinics in the Houston area prioritize having the most up-to-date equipment. And this is great and crucial when caring for patients, but it demands frequent upgrades. This allows us to send equipment that would otherwise end up in a landfill to communities in need. And there are many communities that actually prefer manual or paper charting systems because of their lack of access to power.
Yeah, we take it for granted in the United States. We have the best healthcare in the world. And I think you're right. Everybody wants the latest and greatest equipment and procedures. But like the Russian space program in the 60s and 70s, better is the enemy of good enough. So some of these items can be repurposed and used in places where people have almost nothing and make a huge difference and save some lives.
Exactly. And the sad truth is a lot of these pieces of equipment might be usable for another decade, even 20 years. But just because of the technological advancements, it's necessary that some hospital systems evolve to the landscape.
How do you guys source, collect, equip, and ship the equipment?
So that is a lot of what I do. I am the supply chain manager at Medical Bridges. So I work closely with our operations team and procurement manager. Our procurement manager has relationships and contracts with a lot of the major health systems in Houston and Texas and surrounding area. We just recently expanded into San Antonio, and we're potentially looking at other cities within Texas as well. From the procurement standpoint, then it comes to incoming donations. So we have a team with our operations that sorts each item by like item and by use. So if we receive 3 different types of needles, they all have different manufacturers, but they all have the same purpose. They will be in the same box. We really pride ourselves on monitoring, updating, and constantly checking on labels, making sure that everything is listed correctly, so that when it arrives, we don't have any issues on the customs side as well. Now, getting to that part, that's what I deal with generally, is going to be international shipping and stateside shipping as well. Really, what we'll do is we will completely, from a wish list that a partner will provide us, we will use the community's needs, we will use the hospital's needs in consideration when we are making their container. So when I say a container, it is 20 pallets or the equivalent of 20 pallets of medical supplies and equipment. And supplies can be anything from a breathing tube to a needle, where equipment can go all the way up to incubation machines and anesthesia machines. So we will generally send, and the average value of each container is about $250,000 per container that we will fill and send to communities in need worldwide.
That's pretty interesting. Logistics is tough domestically, but what are some unique challenges with shipping a container of medical supplies to a third world country?
And you hit the nail on the head right there. Domestic shipping is difficult, but international shipping has its own hoops to jump through. And that's part of my job, really just navigating the ever-changing landscape of customs and international shipping is paramount. We constantly are in meetings, seeing updates based on what is happening in the area, how many ships are going out to specific areas. If a new hub has opened up in a specific area, it's important that I stay on top of that so that I could pretty much serve their people just as well as I can, and on top of that, also medical bridges as well. So, majority of the issues that I see when it comes to international shipping are generally from other countries' customs. So, I always say in country is the final destination or receiving destination. A lot of times when it comes to dealing with international customs, they might not have a grasp of some new laws that just got introduced, where I've had situations where a ship has been halfway to a destination and the local laws have changed, requiring us to pivot or at least provide some type of supplemental documentation so that we can get it through. Yeah, when it comes to international customs, some areas, such as Ukraine, are very strict when it comes to gases. We're not allowed to include even Freon if there would be some leftover Freon in a refrigerator or a lab freezer. It's important that we take those precautions to make sure that it fits all safety guidelines of the country. Now, when it comes to specific rural areas of Africa, they actually will not accept wooden supplies because it's taking jobs away from the local carpenters. So all these little things really come into place in making sure that we fully understand what's going into the container and we do all the necessary documentation and procedures before it arrives.
No wood in Africa. That's funny.
It's only specific areas. If it's going to a larger city such as Nairobi, they really won't be as strict with that, but they really try to protect and preserve the local carpenters and jobs as much as they can.
Well, that makes sense. The I guess what brought you to this career? Did you have a background in logistics before?
No, actually, my background really comes from the medical field more than it does logistics. I have always been surrounded by the healthcare industry my whole life through my family, and now currently my sister, who is actually a med student in the Houston area. So serving people has always been in my blood and background, and I feel like that, along with the business side of it, which I actually really do enjoy and is what I studied in college, really allowed me to use a little bit of both. I am able to negotiate, I'm able to talk to individuals constantly while also managing healthcare in other communities around the world.
Yeah, and it's a very fulfilling, I guess, mission that Medical Bridges had, and that's what brought us to it. We are currently the Louisiana strategic partner for Medical Bridges, and we're working hard to spread the message over here and develop sources for medical equipment because we have a pretty robust medical community in Louisiana. We have a lot of sick people, mostly because of the boudin, the different things we eat over here. But there's a lot of equipment, a lot of opportunity to provide used medical equipment to Medical Bridges. So the team here is working on that, and we're happy to be a strategic partner with Medical Bridges. You mentioned sustainability. This is a beautiful thing that Medical Bridges does because it creates sustainability for this equipment that might often end up in a landfill. And when I talked to Walter, the number he mentioned was staggering, the amount of stuff that would go into the landfill. Do you recall that number?
Not off the top of my head. I understand it was millions of dollars worth of equipment. And the sad truth is a lot of it comes down to not even the fact that it's not usable, but it can be just a machine needs to be upgraded. Then on the other side, when you're looking at the smaller items, what a lot of people don't understand is that having an item with a sterile seal is very important, but a lot of times the item itself does not expire where the seal does. So if it's a needle, let's say, generally I would say those have a 5-year shelf life. And that's not the use of the needle. The needle works perfectly fine as soon as it expires, but to ensure that it's sterile, you need to have that 5-year shelf life. So when it comes to a lot of the stuff that would end up in a landfill, specifically when it comes to plastic pollutants, like everyone is very familiar with at this time, really we're trying to avoid that as much as possible. And how we've been able to do that is when we accept any donations, We always try to give at least a 16-month shelf life for any products we're sending internationally. And anything that's shorter than that 16-month shelf life, we try to send with local teams or rural teams. So even items that have been expired, we've had some practices where they've come to us and said, hey, I'm actually going through some training procedures. Would you mind donating some even recently expired items? And that is another way that we've been able to use some of the items that are donated to us.
Yeah, that's very interesting. We found that to be the case with many things. It's not the item, it's the packaging, and it wears out over time. And as a company provides paramedics offshore with a lot of medical equipment, we have a ton of stuff that expires, and quite often it's perfectly good. It just the packaging did not support the time frame.
Exactly. And that's why it's very important to us, especially some of the communities that we've already served will actually request additional containers, because hopefully they will be able to use everything, but on the off chance that they aren't, sometimes they will request more. And we're always there to serve those communities again as well.
Tell me about the team at Medical Bridges. How's the structure? You talked about logistics. How many people work in the warehouse? What's y'all footprint look like?
So our footprint, and like I said, we have been recently expanding. I believe that we have about 10 to 15 people working in our office at all times. And then on top of that, we have about 5 to 7 people working in our warehouse, sort room, and also truck driving as well. So as I mentioned earlier with procurement, we'll actually have, we have our own trucks. We have drivers that will arrive at these hospital systems, and they will pick up this equipment as it's made available to us.
Very good. What's next on the mission for Medical Bridges? How can a company get involved to help, support, donate?
So you said it best right there. Donating is probably the number one way that you could help serve our mission. We are constantly in need of more support. We just recently had our gala, which was an incredible way to raise money, but constantly raising money is important for what our mission does. So looking into the future, Medical Bridges has already served over 115 countries and counting. And although we are based in Texas, this includes states and rural areas within the U.S. as well. So I believe our partnership will only expand our ability to serve communities in need, whether that be stateside or abroad. And our future is continuing to look bright with a partnership such as yours.
Well, thanks, Alan. I appreciate you taking the time to talk to us today. We truly believe in Medical Bridges' mission, and I've talked to at least 6 individuals over there, and every one of them is just like you. They share a passion for helping people. And obviously, as a paramedic, you got into paramedic business years ago to help people. I can sympathize, and we're very well aligned. Our organization is aligned with you guys, and we hope to continue to help y'all move forward in the future.
Oh, well, thank you so much. And like I said, we are always here to serve any community, whether it be stateside or international. So if you ever have any nonprofits, or if you are even interested in finding out more about Medical Bridges, please feel free to contact us at our website or LinkedIn as well.
Thanks, Alan. We appreciate your time today, my friend.
Oh, no problem. Thank you so much for having me, Doug.